Jamaica has a doctor problem, and it's not that the country can't produce them. The University of the West Indies has been turning out medical graduates for decades. The problem is keeping them. Even when Jamaica trains its own doctors and nurses, the global market steals them away. You can't blame them. Why struggle on a low salary at home when the same skills are worth 10 times as much overseas? What you're left with is a public health system running on fumes. Long waits, overworked staff, under-resourced clinics, especially in rural parishes and inner-city communities where the need is greatest. So Jamaica turned to an unlikely partner, Cuba. Under a bilateral agreement, Cuba sends doctors, nurses, and specialists to work in Jamaica's public hospitals and underserved clinics. Jamaica provides stipends, housing, and cooperation agreements in return. For Cuba, exporting doctors is foreign policy. For Jamaica, importing those doctors is survival. It's a way to put a trained professional in front of the patient today, not 10 years from now, when a new batch of local med students graduate. There's another layer too. Jamaican students receive scholarships to study medicine in Cuba, come back with full degrees ready to serve. It's not just a staffing fix, it's a pipeline. The advantages are immediate and tangible. Remote clinics that had no physician suddenly have one. The cost per doctor is lower, at least in the short term, than competing with North American salaries. There's also a transfer of skills. Cuban medical training emphasizes preventive medicine and community-based care, approaches that Jamaica's overstretched system desperately needs. If you talk to many Jamaicans in certain communities, the Cuban doctor isn't a geopolitical chess piece. She's just Doc, the person who actually showed up when nobody else did. But this arrangement has real costs, just not always the ones on the invoice. Critics argue the program breeds dependency. Why fix the pipeline when someone else is plugging the leak? There are language and cultural barriers. Spanish-speaking doctors navigating Jamaican patois isn't seamless. Local health workers sometimes resent the arrangement, feeling sidelined in pay and career progression. And then there are the ethical questions around the Cuban doctors themselves. Strict contracts, limited freedoms, salaries that largely flow back to the Cuban state. So is this solidarity, or is it outsourcing? Is Jamaica getting affordable help, or is it avoiding the hard work of building a self-sufficient health system? The honest answer is both. This program saves lives. It puts doctors where there were none. But it cannot substitute for the harder, slower, more expensive work of training, retaining, and properly paying Jamaica's own medical professionals. If you've been treated by a Cuban doctor in Jamaica, or you're a Jamaican health worker yourself, drop your experience below. We want to hear the real stories, not just the policy briefs. And subscribe, because in the next episode, we'll ask the hard question: what happens if Jamaica dismantles this program?